Every year, millions of older adults head into their doctor's office for routine checkups. It feels like the responsible thing to do. Go in for peace of mind, to catch problems early, to make sure everything's on track. You trust the system, you trust your doctor, and you assume that if something was truly risky, you'd be warned. But what if I told you that some of the most common tests ordered during these checkups that seem harmless, even helpful, might actually raise your risk of a stroke, especially if you're over 60? Now, I know that may sound hard to believe. After all, aren't these tests supposed to protect us? Aren't we told that more screening leads to better outcomes? Here's the truth. As we age, our bodies become more sensitive to stress, whether it's physical, chemical, or even emotional. What may seem like a standard scan or procedure to a healthy 30-year-old can put real strain on an older body, especially if you're dealing with high blood pressure, heart disease, or kidney problems even, if those issues haven't been diagnosed yet. In this video, we're going to uncover 6 routine medical tests that could quietly raise your stroke risk if you're over 60. We'll walk through the science behind them, real-life stories, and most importantly, what questions you can ask to protect yourself and your loved ones. If you've ever felt lightheaded, foggy, or off after a test and didn't know why, this may finally explain what happened. And even if you've never had a bad reaction, knowing what to watch out for might just prevent something serious down the road. So stay with me. What you learn in the next few minutes could change how you approach your next doctor's visit and maybe even save your life. Let's take a step back and look at how we got here. For decades, we've been told that the best way to stay healthy is to test early, test often, and treat quickly. That approach makes sense on the surface. After all, the sooner you catch a problem, the easier it should be to fix right. But what many people don't realize, especially those of us over 60, is that our bodies don't always react to these tests the way younger people's bodies do. As we age, our blood vessels get stiffer, our heart rhythm becomes more sensitive, and our kidneys may not clear substances as efficiently as they once did. Even slight changes in blood pressure or blood flow can have big consequences, especially when we're dealing with vulnerable arteries in the brain. Now here's the tricky part. Not all harm is immediate or obvious. You might leave a test feeling fine, but then experience dizziness, confusion, or a blurry vision a day or two later and not make the connection. Most people wouldn't think to blame a test they did 48 hours earlier. But in reality, some procedures once done routinely can disrupt blood pressure, heart rhythm, or blood flow in subtle ways that can trigger problems, especially strokes or mini-strokes, in the days that follow. What's more, not every doctor will mention these risks unless you ask. It's not because they're hiding anything, it's often because guidelines and habits have made these tests so routine that the risks get overlooked. In some cases, the risks might be low, but for older adults with specific health conditions, even small shifts can cause serious ripple effects. That's why this video exists, not to scare you, but to empower you with the kind of questions that help you become an active participant in your own care. You deserve to know not just what a test is, but what it might do to your system. And once you know the signs to look for and the questions to ask, you're in a much better position to make the right decision for your health. So, let's start with one of the most common and widely used tests in medicine, something millions of people get every year, often without thinking twice. CT number 1 is the Contrast-Enhanced CT scan. This is a scan where a special dye called contrast is injected into your bloodstream. To help doctors see your internal organs and blood vessels more clearly, it's a powerful tool. In emergency rooms and hospitals, it's often used to find clots, tumors, internal bleeding, and more, and in many cases, it can be life-saving. But if you're over 60, especially if you have high blood pressure, heart issues, or even mild kidney problems, this test deserves a second look. Here's why. The contrast dye itself can place sudden stress on your body. Some people experience a drop in blood pressure right after the injection. Others see a sharp spike. Either reaction can interfere with the flow of blood to the brain, something that's especially dangerous if your arteries are already narrowed or fragile with age. There's also the risk of what doctors call a vasovagal reaction, a sudden dip in heart rate and blood pressure. That can cause dizziness, fainting, or nausea right away. But in other cases, the reaction is delayed. Within a day or two, the person might start feeling off disoriented, weak, or lightheaded. In rare but real cases, this can lead to a stroke, or what's known as a transient ischemic attack, or TIA, also called a mini-stroke. One real-life case involved an 81-year-old man who had a routine CT scan with contrast after experiencing some mild abdominal pain. The scan showed nothing serious. He was sent home the same day, but 48 hours later, he started slurring his speech and felt confused. At the hospital, he was diagnosed with a mild stroke. Doctors believe the contrast injection caused a temporary spike in blood pressure, which may have dislodged a small clot. A study published in a respected radiology journal found that older adults who received contrast-enhanced CT scans were significantly more likely to experience vascular complications within 72 hours of the procedure, especially those with hypertension, heart disease, or reduced kidney function. So what should you do if your doctor recommends this kind of scan? First, don't panic. CT scans with contrast are often helpful and necessary, but they should be used with care, not out of habit. Ask your doctor a few key questions. Do I really need the contrast part of this scan? Is there a non-contrast option, or another type of imaging, like an ultrasound or MRI, that could give you the same answers? Have you checked my kidney function recently? If you've had a bad reaction to contrast dye in the past, or if you're taking medications that affect your kidneys or blood pressure, make sure your doctor knows that too. The scan itself isn't the danger, it's how your body responds. By knowing your risks and speaking up, you can make informed decisions and avoid complications later. Test number 2 is the exercise stress test, also known as a treadmill test. If you've ever been asked to walk or jog on a treadmill while hooked up to wires and monitors, that's the one. The goal is to see how your heart performs under physical stress. Doctors use it to detect blockages, irregular rhythms, or signs of poor circulation to the heart. At first glance, it seems like a good idea. After all, if your heart has problems, wouldn't it be better to find out before a real emergency hits? But here's the concern. The test itself can sometimes push an older body beyond its safe limits, and that can be risky. When you're asked to walk faster or on an incline, your heart has to work harder. Blood pressure climbs, your arteries expand and contract quickly, your heart rate speeds up. If everything is working well, this just looks like a good workout. But if you're over 60 and, especially if you have high blood pressure, known heart disease, or even unrecognized blockages, this sudden increase in demand can be too much, too fast. In fact, a major study published in the American Journal of Cardiology looked at over 1,300 people aged 65 and older who had undergone treadmill stress tests. Nearly 7% of them experienced harmful events during or shortly after the test. These included dangerously high blood pressure spikes, abnormal heart rhythms, and most concerning, stroke-like symptoms in some patients. Many of these complications happened in people who looked healthy and had no current symptoms. Take the case of Margaret, 74-year-old from Ohio. She'd been living with high blood pressure for years, but felt fine. Just to be safe, her doctor suggested a treadmill stress test. Midway through, she began to feel dizzy and had tightness in her chest. They stopped the test immediately. But the next day, Margaret suffered a minor stroke. Doctors later said a sudden surge in blood pressure during the test likely ruptured a tiny vessel in her brain. This doesn't mean stress tests are bad, but they do need to be carefully considered, especially for older adults who aren't experiencing symptoms like chest pain or shortness of breath. So what can you do? Ask your doctor. Is this test truly necessary right now, or can we monitor things a different way? Are there alternatives that are safer for someone my age? There often are. Nuclear stress test, which uses medication to mimic the effects of exercise. Or a resting echocardiogram may provide similar insights with less physical strain. These are especially helpful for people with limited mobility or known vascular concerns. You don't have to say no to every test, but you do have the right to understand what it involves, whether it's the best choice for your body today. Test number 3 is the sedated endoscopy, which includes procedures like colonoscopies, upper GI scopes, or esophageal exams that require some level of sedation. These are often recommended as part of routine screening after age 60, especially for colon cancer. Now, these tests can be incredibly useful. They've helped catch early cancers, ulcers, and digestive issues before they become serious. But if you're over 60, and especially if you're taking blood thinners, These procedures may carry risks that many people never hear about. Here's the issue. Sedation affects how your body controls blood pressure and circulation. It slows everything down, your breathing, your heart rate, and how blood flows to the brain. That can be a problem for older adults whose systems don't recover as quickly from sudden changes. At the same time, many seniors are taking medications like aspirin, Plavix, or warfarin to reduce the risk of heart attacks or strokes. These drugs make the blood thinner and reduce clotting. When you combine sedation with blood thinners, you increase the chances of internal bleeding or, in some cases, of a clot traveling to the brain during the recovery period. A large review published in Gastrointestinal Endoscopy in 2021 found that patients over 65 who had sedated endoscopy procedures were more likely to experience what's called a transient ischemic attack or than 72 hours. These are mini strokes that may only last a few minutes or hours, but are often a warning sign of bigger problems ahead. Consider the story of a 76-year-old woman who had a routine colonoscopy. She wasn't experiencing any symptoms, and the procedure itself went smoothly. But 2 days later, she began slurring her words and couldn't keep her balance. At the hospital, doctors confirmed she'd had a mild stroke. They suspected the drop in blood pressure during sedation, combined with her daily aspirin use, may have created the right conditions for a small clot to reach her brain. So what can you do to lower your risk? Before agreeing to a sedated procedure, ask your doctor, do I really need this test right now, or are there less invasive ways to monitor my health? Will I need to stop any of my medications before the procedure? Can this be done with a lighter sedative or without sedation at all? And always make sure your doctor knows every medication you're taking, including over-the-counter drugs and supplements. Sedation may feel routine, but for an aging body, it's a big event. Knowing how it interacts with your medications and your health conditions can help you make a safer, more informed decision. Test number 4 is the MRI scan with contrast, a common procedure used to capture highly detailed images of organs, blood vessels, and tissues. These scans are often ordered to investigate chronic pain, potential tumors, or suspected nerve damage. And like CT scans, when contrast is added, it gives doctors a clearer view of what's happening inside your body. But for older adults, especially those with even mild kidney issues, this added contrast can sometimes do more harm than good. The contrast used in misters usually contains a heavy metal called gadolinium. It's designed to travel through your bloodstream and highlight areas of concern in the scan. Normally, the body filters it out through the kidneys shortly after the test. But here's the catch. Kidney function naturally declines with age. Some people over 60 may have reduced kidney efficiency without even knowing it. When the kidneys aren't working at full capacity, they may not clear out the gadolinium as quickly or at all. And in some cases, this leftover contrast has been linked to rare but serious complications, like nephrogenic systemic fibrosis, a condition that causes thickening of the skin and connective tissue. It can make movement painful and difficult. But perhaps more concerning is recent research showing that gadolinium can also linger in brain tissue. While we don't yet know the full long-term effects, some studies have found that patients who received repeated gadolinium-enhanced MR were more likely to experience short-term neurological symptoms, such as confusion, dizziness, or mental fog within days of the scan. One such case involved Harold, 79-year-old veteran who was referred for an MRI with contrast due to persistent back pain. 2 days after the scan, he felt unusually tired, lightheaded, and foggy. Lab tests later revealed he had stage 3 kidney disease, which no one had diagnosed before. His body may have struggled to clear the gadolinium, leading to those temporary neurological symptoms. So how can you protect yourself? Before undergoing an MRI with contrast, ask your doctor, is the contrast absolutely necessary for this scan? Could a non-contrast MRI provide the information you're looking for? Have my kidneys been checked recently, specifically my GFR levels? If you've ever had a strange reaction to imaging tests, be sure to mention it. And if you're already taking medications that affect kidney function, like certain blood pressure or diabetes drugs, bring that up too. The MRI itself isn't the issue. It's the contrast agent and how your body handles it that makes all the difference. With just a few questions and some advanced planning, you can make sure your next scan helps, not harms. Test number 5 is the carotid artery ultrasound. This is a non-invasive scan that checks for narrowing, or blockages in the carotid arteries, the two main blood vessels in your neck that supply blood to your brain. The test is painless, quick, and doesn't involve needles, dyes, or radiation. That's why many people don't think twice when their doctor orders it as part of a routine checkup. But here's something most people over 60 aren't told. If you don't have symptoms like dizziness, vision changes, or numbness, this test could start a chain of events that leads you to unnecessary and potentially risky surgery. As we age, it's completely normal for the carotid arteries to develop some plaque buildup. That doesn't always mean trouble. In fact, many people live perfectly healthy lives with mild or moderate narrowing that never causes a problem. But once a test shows something like 60% blockage, the instinct is to act fast. That's when some patients are referred to a vascular surgeon, even if they've never had a stroke or warning signs. Here's where it gets risky. Procedures like carotid endarterectomy or carotid stenting do come with potential benefits, but they also carry real risks, especially in older adults. Stroke, bleeding, infection, and nerve damage are possible outcomes, even in otherwise healthy patients. A major study published in the New England Journal of Medicine followed over 3,000 seniors with moderate narrowing in the carotid arteries. It found that in people without symptoms, surgery didn't reduce the risk of future strokes any more than medication and lifestyle changes did. Worse, a small number of patients actually experienced strokes as a direct result of the procedure. Take Helen, an 82-year-old from Pennsylvania. She felt perfectly fine during her annual checkup. Her doctor ordered a carotid ultrasound just to be thorough. The scan showed 65% narrowing. Within weeks, she was in surgery, and during the operation, she suffered a minor stroke. She survived, but was left with lasting weakness on her right side. "If I'd known that doing nothing might have been safer," she said, "I would have asked more questions." So what should you do? If your doctor suggests a carotid ultrasound and you don't have symptoms, ask, "What are we looking for? If we find something, what will we do next? Will it change how we manage my health?" If you're already on blood pressure and cholesterol medications, eating well and staying active, added procedures may not provide much extra protection. Remember, testing is only helpful if it leads to better outcomes. Sometimes, especially as we age, watchful waiting is the safest path. Test number 6 is the pharmacologic stress test, also known as the medication-based stress test. This test is often used when a person isn't able to walk or run on a treadmill due to limited mobility, joint problems, or other health concerns. Instead of exercise, a medication is used to make the heart work harder, mimicking the effects of physical exertion. On paper, this might sound like a safer option for seniors. There's no treadmill, no fast walking, just a simple injection. But the reality is more complicated. The drugs used in this test, like dobutamine or adenosines, stimulate the heart. They speed up the heart rate, increase blood pressure, and change how blood flows through the arteries. This makes it easier to spot areas of the heart that aren't getting enough blood. But it also puts sudden stress on the cardiovascular system, stress that can be risky for an aging body. In some cases, the rapid increase in heart rate and pressure can lead to abnormal rhythms, chest pain, or a temporary reduction in blood flow to the brain. That's especially concerning for older adults who may already have silent circulation issues, a history of stroke, or vulnerable blood vessels. A study published in the Journal of Nuclear Medicine followed a group of patients over 70 who underwent pharmacologic stress testing. While most did well, a significant number experienced short-term symptoms afterward, including dizziness, disorientation, or irregular heartbeats. Some of these symptoms didn't appear until several hours after the test. One example is Mrs. Lan, a 75-year-old woman who couldn't do a treadmill test due to arthritis. Her doctor recommended a medication-based stress test instead. The test seemed fine at the time, but a few hours later she felt unusually tired, lightheaded, and confused. Her symptoms passed within a day, but they left her and her family shaken. The good news is, you can take steps to protect yourself. Before having a pharmacologic stress test, ask your doctor, "Is there another way to evaluate my heart without using medication? Am I at higher risk for side effects due to my age or medical history? Will someone be monitoring me closely during and after the test?" In many cases, a resting echocardiogram or a cardiac MRI may provide similar insights with less risk, especially if you're not currently experiencing chest pain or unusual fatigue. Medication-based testing isn't wrong, but like all tests in older adults, it should be used thoughtfully, not automatically. Your body's response to medical stress isn't the same as it was 20 years ago. That's exactly why asking the right questions matters. We've just gone through 6 common medical tests, each one widely used, each one potentially life-saving in the right situation. But as we've seen, they can also carry real risks, especially for those of us over 60. The CT scan with contrast, the treadmill stress test, sedated procedures like colonoscopies, MRIs with gadolinium, carotid ultrasounds, and medication-based heart tests, they all have their place in medicine. But the key takeaway is this: not every test is automatically right for every person. As we age, our bodies become more sensitive. The systems that once bounced back quickly now require more care, more thought, and more personalized decisions. That doesn't mean avoiding all tests. It means choosing wisely, based on your unique health status. It's not just a checklist or a routine. The most powerful tool you have in protecting your health isn't a scan or a machine, it's your voice. You have the right to ask your doctor, do I really need this test right now? What are the risks for someone my age with my medical history? Are there safer alternatives we can try first? If a test is necessary, you'll understand why. And if it's not, you've just avoided a procedure that could have caused more harm than help. We're not here to create fear, we're here to build awareness. Because when you know what to ask, when you feel confident enough to pause and get the full picture, you take control of your health in a way that really matters. So if you've ever felt off after a test, or if a loved one went through something unexpected, you're not alone. Share your experience in the comments. Ask questions. Most importantly, stay curious. Your health deserves it. If this video helped you feel more informed, please consider subscribing. We share content focused on smart, safe aging because growing older shouldn't mean giving up control. It should mean gaining wisdom. Before we go, I want to thank you for taking the time to learn about these important topics. Just by watching, you're already taking a more active role in your health, and that matters. If this video made you think differently about your next doctor's visit, share it with someone you care about. You never know who might need to hear it. And if you'd like to see more content like this, simple, clear, and focused on smart choices as we age, hit the subscribe button and turn on notifications. I'll be here every week, asking the hard questions and putting your well-being first. Thank you for spending this time with me. Stay well and take good care of yourself.